I'm live. So, this evening is 5 o'clock. Good evening. So, I have not, hey, Anita Mary K. Joy. I have not been doing live feeds. Oh, in a couple of days. I have been active on TikTok and TikTok stories. And I have been, well, for this past week, I don't think that I have did any TikTok videos. Um, I had a message that I was gonna come on here and I was gonna say, but I don't know. I'm kind of choosing my words carefully. So what I'm gonna talk about is counting your blessings, being thankful for the little things. This pandemic, they said this was what, the third round, fourth round of COVID. But we are in some desperate times right now. And I say that because me, as a healthcare worker for 25 years, they're constantly changing things. And I have been out of work for 30 days. This is the longest period of time that I have been out of work as a healthcare worker. I have never, even in my 25 years of, I can't say in the whole 25 years I've been perfect, but even if I ever lost a job, if I got fired, I have never been unemployed as a healthcare worker for longer than, I would say, maybe a week. But I've never been off work for 30 days. The reason why I was off work for so long is because they started making the healthcare workers get the COVID tested. And I'm not saying that they shouldn't, but it was taking just about 30 days. I took a COVID test. In every facility that you go to and try to work, it is a part of the hiring process. So if you've already been tested, that does not matter, and you already got your results back and they're negative. If it's a different job, they want you to go and take the test again. I have been tested 4 times, and all of the tests have come back negative. But the thing of it is, it's very painful. The tests are painful. Some people say they're uncomfortable, but I feel that it's necessary to be tested, but I don't think it's necessary to be tested that many times. I think if you have been tested already and you have your results and they're negative, then you should not have to go and be retested again, especially if it's in the same month and you have not been exposed to anybody and you haven't been anywhere. For 30 days, I've been at home. So, and I have not been out of the state or come in contact with anybody that has it. So, and then it takes longer. I mean, when you do that, you have to wait for that results to come back from that job. And it's been taking, and I've, talked to some other friends of mine that work in healthcare, do the same job. It has been taking everybody 3 to 4 weeks to get the COVID testing back. In the meantime, your bills don't stop. You're getting farther and farther behind on things. And because I'm a healthcare worker and I don't have small kids, they say they have resources out here to help everybody. But come on, y'all, let's be seriously real. They are not going to help everybody, okay? They're not going to help everybody. That's insane for you to think just because they have the resources out there and that they say they're not going to help everybody. There are so many people in need. There are so many people on unemployment. And unemployment, that's another thing, And so, I mean, it's really desperate. We are in some seriously desperate times. And what I have experienced, to me, has really hit home. And now I see what somebody said when the beginning of this pandemic happened. y'all gonna have to, hey, it's coming down to, if people would have learned, I wish that I would have learned to save a penny. Because if I had learned when things were good, before we got into this pandemic, to save some money, then I could have went to my savings, okay? Then I would not have been in such a desperate need of help, But I don't think, I'm not the only person, I don't think anybody has really learned to save a penny. Most of us live anywhere from paycheck to paycheck, And it's coming down to the point in the healthcare business, there's a lot of nurses and nurse aides that I know of that normally work 2 jobs. It's hard for them to work 2 jobs now because some of the facilities, if you're already working somewhere, they don't want you to work anywhere else because of COVID. Everybody is scared of COVID. It's on a panic. And I'm just going to share my personal story, what has happened to me, how COVID has affected me. I am in my late 40s, okay? I'm just going to be real and 100% when I say this because somebody else might go through this. I am going through what they call pre-menopause. So what that means is body temperature is different. I have hot flashes. So what was actually happening to me, I was working the 3 to 11 shift. It's hot as heck. So walking through the parking lot, putting on all the attire once I got into the building that I have to work in for COVID because they made us wear this whole get-up. And everybody in the facility had to wear it until they get your COVID test back. But my temperature would be at what the range is, what they said that I had to go home. So I would get sent home without pay. And I was told by the administrator that I should not have been in the building with that type of temperature, and I did not have COVID. So I was sent home a series of 10 times, which affected my paycheck, which caused my bills to be behind. And so now I'm playing catch up with everything. But it's going to work out. It's going to work out. God is working. He works through people. It's going to work out. I have no doubt that it's going to work out. But my whole point is this has taught me a valuable lesson. It's always going to be, what did you learn from the experience, And I learned from this experience that I'm just going to say it like this. It may come to a time where we're going to have to help each other here. It may come to a time where if you got a little bit extra, you might have to help somebody You might have to help one of your family members. You might have to help one of your church members. And it can be the little things. It can be either with giving them a meal, to putting gas in their car, to paying a light bill. And if you really balling, you might have to pay their rent or half of it or something. We are in desperate times, and it is just unreal that all these resources that they say the government is giving is going to help everybody, because you have to qualify. I'm not saying that you have to qualify, but it's a lot of red tape on what they want you to do to be able to qualify. And there are some people that they may think make too much money and they're not helping them. And so I'm just telling you the real side of it. And so when people are always urging people to go and to these resources thinking that they're going to be helped, well, it's going to probably be a first come, first served, I would think. I'm just saying. So, that's all I had to say. I can say that when COVID first started for me was on March 17th, and I was working. And I was making a decent salary, and I did help those at that time in need that needed stuff. But that was just at the beginning of it when it first happened. But I was in fact affected by it then, and I didn't really think, being a healthcare worker, that I would be affected because we've always worked no matter what. But as COVID progressed, then the nursing facilities that I was in, they were scared. They wasn't taking, for a minute, nobody was going to the hospital. They wasn't taking new patients, and so the census was low. And anytime the census is low, that means they don't need as many workers, so they started sending healthcare workers home. So, and then when that starts happening, then you're not getting 40 hours, and which presents a long period of time, you get behind. And so, and each facility operates different, just each facility. But like I said, God is good. He works, and he works through people. As of today, I'm back working. I start working tomorrow. And yes, I got full-time hours. And yes, it is what it is. So, but that didn't come with not staying consistent in prayer. Things got scary for me. Things got desperate for me. For the past couple of nights, I have not rested good, because I'm not gonna lie. I did worry because I have never been in this type of situation. I've never seen things this bad. I have never had to really, I've never had to really ask for something, have to go outside and try to find resources to help me, because I've always been employed. I've always worked extra shifts as a healthcare worker. I've never really had to depend on anybody like that, so it was very scary. But the one thing that I see is that some people just don't understand, Some people just do not understand. If they don't have that experience and they have not been there, they don't understand. And they don't understand. And it's hard for me to explain it if you're not a healthcare worker. But as I was placing the applications, I ran to a charge nurse, and I had shared my story to him and told him how I was out of work and had been stressful, and I had been on several applications, and the holdup had been the COVID test. And he understood that, because as a nurse and in the same profession that I was in, he had a second job as a nurse that he ended up losing through the pandemic because of the COVID testing. So they understood how that is. And what people don't understand, as a healthcare worker, I'm on the front line. I'm called an essential worker. I'm more hands-on than a nurse. And if you have a runny nose, any type of respiratory issues, they do not, and you don't necessarily have to be running a temperature or not, they do not want you at work. They don't know if you got it or not. And even if you don't have it, they don't want you at work. If you're running a temp, they don't want you there. You may not even, it could be something else. You could have a sinus infection, but still, it's too risky for them. They are scared. They don't want you there. They won't even allow us to go outside for our lunch breaks. We have to eat what's there. We cannot leave the building. People don't understand how serious it is. Even when people come and try to place applications for employment, they don't even let you in the building. They stop you at the door. And one job I went to had a can of Lysol, the wipes. They want you to spray your shoes down. They want you to wipe your cell phone down. They want you to wipe your purse down. You have to go through all this, and they got the thermometer right there on the table. They want you to do all of this, and then they want you to put this plastic gown type thing around you before you come in. So people really don't understand what it is, how it's so much of a change for us in healthcare, and it's a change, period. And it is stressful. Not to mention that, we're scared anyway because we're on the front line and we're not where we can quit doing this type of job, and somebody's got to do it. So we already scared. But luckily, knock on wood, in every facility that I have worked with during the pandemic, nobody has had COVID. So but there are other issues, like working shorthanded. And I mean, so it is not something that is easy, but somebody has to do it. So I just want to come on here and just say that, sometimes you have to count your blessings. And it might be that you might have to help somebody that's less fortunate than you. Um, I don't know the word I wanted to use. I had this all planned out, but it might just be with compassion and just trying to understand. But a lot of times, if people are not in that type of situation and it's not them, they're not affected by it in any way, then they don't care. And I did not catch COVID or the virus, but I have listened to several people who did catch the virus, who was affected, who was quarantined for 14 days and now is okay. And they tell their story. And I say, if you have not been indirectly, if you didn't catch the virus, you're still affected in some way. Some people are still affected with what's going on. I didn't catch the virus, but I was affected behind all of the changes, and I'm affected financially. And a lot of people are affected financially that are really out of their jobs. I used to work for Postmates, and if you know what Postmates is, it's kind of like DoorDash, where you deliver food. Before the pandemic, I was doing really good with Postmates delivering food. That was one of my little side hustles. And when they closed everything, I was doing good with it. But soon as they opened up everything, I was not doing good. I went from getting 5, 6, 7 deliveries a day to one every once in a while. So, I mean, it's really, and I guess, maybe they got more since people were laid off. Maybe more people were taking my routes. Maybe more people were delivering food, and I don't know. So, I mean, that's something that has happened as well. And it may just be that since people are unemployed and this pandemic hit so hard that they may not just be ordering out anymore. They may not have the money to. And maybe it's just every so often now. So it is a lot to think about and a lot to be praying about. And so I'll just tell everybody, stay prayed up. Stay prayed up. And count your blessings. And be thankful for the little things. That's all I have to say. Until the next time. Bye.